Tooth problems are very much common in pregnancy. Many patients complain of toothache in pregnancy, tooth pain in pregnancy. Many patients visit dentists and they advise for the removal of tooth or dental filling of the cavity or root canal procedure during pregnancy. Whether tooth can be extracted in pregnancy, whether the dental procedures can be carried out in pregnancy, do tooth ache or tooth pain cause any problems in pregnancy. We'll discuss all these problems. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. So first and the foremost question, why are dental problems or tooth problems common in pregnancy? See, what happens is pregnancy basically what it does is it evokes or it explores many diseases which are unknown before pregnancy. Many diseases are uncovered during pregnancy, especially in those females who have got poor oral hygiene, poor dental hygiene, poor oral health. In those females especially, there are more tooth problems in pregnancy, and because of the progesterone hormones, the changing hormonal levels, it leads to the swollen gums, it leads to the what they say, the teeth loosening, the ligaments around the tooth and the bones which hold the tooth, they become loose, and as a result they are more prone to the dental infection or all the kinds of tooth problems in pregnancy. Also, there is increase in blood supply, the vasculature, the blood supply to the tooth is more, and as a result what happens is there is more inflammations in the gingiva or the gums, which makes it more prone to pregnancy tooth problems. Now, most of the people have this problem in tooth. If there is a toothache, the first question they come to us and they ask, sir, what can we do about this toothache? Which medicine can I take at home? So first and foremost, do not take any painkiller. The best painkiller is paracetamol or a crocin tablet, 500 milligram or 650 milligram on an SOS basis. You can take it maximum 3 times a day, and if the pain does not subside, then please go to your gynecologist and to your dental doctor to get it further evaluated. Apart from the medicine, you can apply ice application. Any ice pack would do. Heat would not help in the tooth pain. Do any kind of ice application and do salt water rinses. Do it swishing. Salt water, what it does is basically acts as some kind of an antiseptic. And we also, these three things should be done at home on a regular basis whenever there is a tooth pain, this thing. So, do tooth problems cause any kind of effect to the baby? Answer is categorically no. But any females who have got history of periodontal disease, who have got tooth infection, there is an increased chance of a preterm delivery or a delivery before the designated time. It can be at 5th month, 7th month or 8th month. Because of that preterm delivery, the child may be of low birth weight, and the complications of low birth weight may be there. So any kind of tooth pain, toothache or tooth infection may lead to preterm labor, which may lead to the complications. So directly per se tooth pain may not lead to the complications in baby, but that may lead to the preterm labor. So tooth pain, toothache has to be treated promptly. So first of all, what can be done to prevent these things? Like I said, a good oral health and a good dental hygiene is very, very important. Use any fluoride based toothpaste. I normally suggest to my patient that patients should be brushing at least 2 to 3 times a day, and every time you should use a different variety of toothpaste. This is my personal thing, this has got no scientific logic, but either you use one white toothpaste, one red toothpaste and one brown toothpaste. White is Colgate or Pepsodent, red is somewhat like Close Up, or brown is Vico or Dabur, because every toothpaste contains different things, and moment if you keep on using same toothpaste again and again, the bacteria in our mouth, they get used to the toothpaste, and as a result the toothpaste doesn't affect the bacteria. So you should keep on changing. Ideally you should be rotating after every meal. After every meal you should brush your tooth, and whatever you eat you should be doing antiseptic chlorhexidine rinses, and it should be swishing moment. If I can demonstrate, take 1 teaspoonful of any chlorhexidine liquid, put it into mouth and start doing like this, from top to bottom, from one side to other side, and this movement is called as swishing. You take it only 1 teaspoonful or only 5 ml. The moment it combines with the saliva and you do swishing, the amount would increase, and after a period of time that amount would become very much. And do it for at least 3 to 4 minutes. And after swishing with an antiseptic mouthwash, do not eat or drink anything. Next thing is, do salt water rinses regularly. Change your toothbrush, also use soft bristles. And last and most important thing, do not eat anything sweet. Whenever we eat some sweet kind of chocolate or mithai or burfi, some particles, they lie between our teeth and they decay, they go there and then they decay there. So a good oral hygiene is very, very important for the prevention of any tooth problems, especially in pregnancy. Now, because of these tooth problems, like I mentioned before, it can lead to preterm labor. That is why we as gynecologists are very, very strict, and we tell our patients to maintain a good and a strict oral hygiene. So, the question is it safe to remove tooth in pregnancy? Answer is yes, it is safe. But I normally consult with the dentist. I have a telephonic talk with the dentist and I ask her what is the emergency to remove the tooth. If the tooth is broken, if it has decayed, and if that tooth may cause some kind of infection in pregnancy, then it is better to remove it. But if that procedure can be delayed for 2 to 3 months, I normally request my dentist and ask my patient to just tide over the things, because in very few cases it may lead to the preterm labor. Is there any kind of a specific posture in which to sleep during pregnancy? Answer is no. You can sleep anyhow in which you find it comfortable. What kind of drinks to take? If the patient is having toothache, you can take any drink, but milk with turmeric sometimes helps better. It is anti-inflammatory. For pain relief, it is better to apply ice application. Please do not take Combiflam, Voveran, diclofenac, Danamar, any kind of a painkiller in pregnancy. Any kind of painkiller in pregnancy has got problems in the baby. It may lead to the premature closure of the patent ductus arteriosus, and during or after delivery, baby may have some kind of problems. Is dental anesthesia safe in pregnancy? Answer is yes. Is dental radiography safe in pregnancy? Answer is if with the use of a proper lead apron, the dental radiography or the x-rays of the tooth are absolutely safe. It may not harm. Can tooth infection harm the unborn baby? If it is properly controlled, it may not harm the baby. What are the symptoms of tooth problems in pregnancy? There may be toothache, there may be increased sensitivity, there may be foul smell of breath, there may be loose teeth during brushing. All these things are problems indicative of a tooth problems. Can a pregnant woman have a tooth filling? Answer is yes. There is no issues, no problems of getting a tooth this thing. Can the root canal be done? Answer is yes. Again, like I said, it has to be done in a consultation with a gynecologist. If the gynecologist feels what is the urgency of doing a root canal? If it is life threatening, if it suggests that the infection may spread, then and only root canal should be advisable. If it can be delayed, if it can be elective, and it is an emergency, then normally we advise during second trimester, that means between 3 to 6 months. Otherwise, if the dentist feels that this can be delayed for couple of months, then we say it is better to do till delivery or after the delivery. How long does toothache last? It depends upon the cause of the infection. If it is an early infection, antibiotic has been started early, then the toothache may resolve in couple of days. If the infection is already set in, then it may take 5 to 7 days. But if the pus has been formed, then even with the antibiotics, the effect may not be much, and the pus has to be drained out. The most common question everybody asks me is, dental treatment safe during pregnancy? Answer is yes. Second trimester is the safest time. Normally we avoid during third trimester. If it can, again, like I mentioned, I'll say it again and again. If it can be delayed, it has to be delayed just till after the delivery. Most of the people feel that in pregnancy the calcium to the baby comes from the teeth or the jaw bones. Answer is no, it is a wrong thing. Can tooth infection go from mother to the baby? Again, answer is no. Safe period for dental treatment, I have again mentioned, second trimester is the safest period. Dental fillings can be done. Which antibiotic is safest in pregnancy? And augmentin is normally very safe for 625 milligram 3 times a day for 5 days, again in consultation with your gynecologist and your dental doctor. It is the first choice drug. The effect of augmentin starts coming, any antibiotic for that matter, starts coming after at least 48 to 72 hours. How many days does a tooth infection last? Like I said, 5 to 7 days. Does pregnancy increase the risk of cavities? I mentioned yes. Answer is yes, because there are more cravings, especially if you eat more sweet things, it may increase the risk of tooth infection. If the tooth infection is not treated in pregnancy, can it be harmful? Answer is yes. Infection may spread to up, it may spread to down. So an early antibiotic, if there is a tooth infection, is very important. Even if there is an abscess, even if we are going to drain the abscess, putting a small incision or a small nick to drain the abscess out, the antibiotic coverage has to be given to prevent the spread of infection. What dental procedures are safe in pregnancy? Any routine dental procedure in the hands of a good dental doctor in consultation with gynecologist is absolutely safe in pregnancy. How to avoid dental problems in pregnancy? To avoid dental problems in pregnancy, the good oral health, the good oral hygiene has to start before you plan to conceive. Again, I mentioned avoiding of any sweets, especially at night time. Brush your tooth at least twice daily, preferably with different toothpaste, preferably with toothpaste having fluoride, and regular uses of mouthwashes, especially after any major meal. This is very important. The use of mouth fresheners may help just in halitosis or the foul breath, but the cause may not be this thing.